Hi, my name is Tamara Augustin, and I'd like to introduce Taylor Perry Crawford and Alyssa Kutry. We're going to focus today our project on sexual gender violence. I am Tamara Augustin, and I'm specifically going to target women and some of statistics on males who experience gender violence as well, or domestic violence in this case. Today, I will be speaking to a group of teenage girls who go to the Tamara Augustin Alternative School. Some have some other needs, some other social needs that they've been going through. So here it is. Hi, ladies, how are you?
Fine.
Very nice to meet everybody. I wanted to give the stats on gender violence, sexual gender violence against women. More than 1 in 3 women and 1 in 4 men in the US will experience rape, physical violence, and or stalking by an intimate partner in their lifetime. 1 in 7 women and 1 in 18 men have experienced stalking, victimization during their lifetime, in which they felt very fearful and believed that someone was close to them would be harmed or killed. 74% of all murder-suicides involve intimate partners, spouse, common law spouse, ex-spouse, boyfriend, girlfriend. Of these, 96% of women are killed by their intimate partners. For you ladies, 1 in 5 female high school students report being physically or sexually abused by a dating partner. Interpersonal violence is the leading cause of female homicides and injury-related deaths during pregnancy. On a typical day, there are more than 20,000, phone calls placed in domestic violence hotlines nationwide. Some other physical impacts on domestic violence include, but not limited to, chronic pain, heart disease, diabetes, asthma, arthritis, heart problems, sexual problems, digestive problems, problems sleeping, eating, and even problems with your immune system. Psychological and emotional impact on domestic violence, like heightened fear, anxiety, depression, anger, post-traumatic stress, social withdrawal, even drug and alcohol use and dependence, and of course, suicidal ideation. The social impact of domestic violence includes women who suffer from isolation, inability to work, loss of wages, lack of participation in regular activities, and limited ability to care for themselves and their children. And they often experience social isolation, including their own extended families. The 10 warning signs, ladies, of an unhealthy relationship is when a guy's checking your phone, or a partner rather, extreme jealousy, constant belittling, explosive temper, erratic mood swings, physical inflicting pain on hurt in any way, possessiveness. These are things that you guys need to look for as red flags, and they won't go away. It will only get worse, especially when it's not confronted. For those of us who want to stay, if you decide at this time to stay with your abusive partner, so there are some things you can try to make your situation better if possible. You can contact the domestic violence sexual assault program in your area, build a strong support system as your partner will allow, and be kind to yourself. Develop a positive way of looking at yourself and talking to yourself. Use affirmations, and more importantly, see if you can get some counseling. Help for abused men. You are not alone. Men too, yes, ladies, experience domestic violence. It may look differently than it would for women. An abusive wife or female partner may hit, kick, bite, punch, spit, or even use their child against them. Call their jobs, make up stories, try to get them fired. All these things that are abusive, although they're not physical, can cause some great emotional stress. Leave is possible, gentlemen. Never retaliate. Get evidence of abuse. Report all incidents. We all know that usually when there's a domestic dispute, the males are more likely to get in trouble than the females, depending on the situation. Help for abused, battered women, safety plans. Like I said, get to know your abusers, red flags, identify safe areas of the house, come up with code words. And when I mean by safe areas of the house, money is another form of abuse with your finances. Hide some money to see if you finally want to get away from the abuse. Get ready to leave at any moment's notice. Phone safety for abused, battered women. Avoid cordless phones. Call collect if you have to. Check your cell phone settings to see, make sure that they're not able to access your phone. Just a quick tidbit on how it affects children. 75% or more of children who are involved in domestic violence families are more likely to commit violent crimes, 3 times more likely to repeat cycle in adulthood. If you need any help, there are legal help, counseling, mental health support groups, services for your children, employment programs. Ladies and gentlemen, if you ever need help, you can give me a call. Now, I would like to play a video for you. Hopefully you can hear it. Give me 1 second. It's called A Call for Pizza. It's pretty much a woman trying to disguise she is calling the police for pizza because her boyfriend is right next door and he is threatening to kill her. And that's the only way she knows how to pretty much help herself. Can you hear it? If you can't, let me see if I can play it differently. Maybe you would see the caption much better this way. I forgot to put the caption on. I apologize. Thank you guys so much. I'll be more than happy to answer any questions that you may have. Thank you.
Hey, hi everyone. My name is Alyssa. Thank you for coming to meet with me today. I know you are parents of a teenage daughter who recently disclosed to you that she was sexually assaulted by her boyfriend. I'm so sorry to hear that that happened to her. Um, I know that you are also feeling a little bit scared for her. You're not really sure how to help her. So it's great that you've come to my office. I'm going to give you some information about sexual assault and how to best support your daughter through this. I also just want to put out there first that none of this is your fault. You might be feeling some shame or some guilt for not knowing that this event occurred, and for feeling like you might not have been able to protect your daughter. So I just want to say that none of this is your fault. There's no way you could have known that this would happen. So, I'm going to go over some of the effects that sexual abuse can have on a child because knowing these can make you a lot more aware of warning signs of how to best support your daughter. So, first being physical. So, obviously, sexual abuse has to do with your physical body, and it can be very traumatic for anyone, especially a child. So, after being sexually assaulted, children can have a poorer overall health. They might have feelings of pain. There could be other very specific symptoms in their body, like gastrointestinal symptoms, gynecological, even cardio symptoms. And children who are sexually assaulted or abused do have a higher likelihood of obesity later in life. due to the impact of this trauma. Next, emotional. So, there's a variety of ways that sexual assault can affect a child's feelings and emotions. They might have an increase in nightmares or other problems with sleeping. Their behavior might change, so they might feel more withdrawn from their friends, or just, from you guys, from themselves. They could become more angry and have big outbursts of anger. They might be feeling anxiety or depression. Your daughter might not want to be left alone with certain people. I don't know if she is still with this boyfriend, but she might not want to be with him anymore or be left alone with him. And they also can have an increased knowledge on, sexual language or sexual behaviors that could be inappropriate for a child's age. Psychologically, a lot of long term outcomes for sexual assault can include post traumatic stress disorder, depression, eating disorders, which also plays into the physical aspect of obesity, sexual dysfunction, like we mentioned earlier. Later in life, they might start abusing alcohol or drugs as a way to cope with the trauma. They may have suicidal ideations or threats. They also can have physical symptoms that have no explanation medically. There's no medical condition that explains why they're experiencing these things. And they also might become very preoccupied with their physical appearance and how they look. So, socially, your daughter might start to isolate herself from other people. She might be feeling fear or distrust of others. Her trust was broken with this assault. She might start to struggle in school, have trouble focusing or being in that environment. She may start to have low self esteem, and she could have trouble forming and maintaining relationships, whether that be with her parents, you guys, with friends, or, with our boyfriend or other romantic partners. So I know that's a lot of information, and I know that it sounds very scary, but I do want to give you some things that you can do next, um, that are a little bit more positive and ways to best support your daughter. So first of all, you and your daughter might be feeling angry or anxious, sad, in shock, and all of these are appropriate feelings to have right now. But it's also important to allow your daughter the space to express how she's feeling and what she might be thinking. So just remember to be empathetic towards her and, try not to guess or assume what she's feeling. If you have a good relationship with her, which it seems like you do, you could try to have a conversation with her about how she's feeling and create that safe space for her to come to you. Try to avoid some questions that might feel intrusive or, asking her about specifically what happened, and focus more on understanding how she's feeling right now and what she might need from you right now. And just a few other things that you can even say to your daughter right now are things like, I believe you, and that you don't blame her in any way, but that you blame her boyfriend who assaulted her. It's also good to remind her that the abuse doesn't say anything about who she is, and that you don't see her any differently because of the abuse. And lastly, just remember to remind her that you can always talk to her at any time that she needs, and, make yourself available for any of those difficult feelings that could come up now or even later down the line. So it's just important to remember that even though this is a really difficult time for you and your daughter, there is a path through this, and getting her connected with therapy services is a great first step. So thank you again for coming and listening.
Thank you.
Thank you.
Well, hello, Tyler and Alex. Thank you so much for attending our supportive group today. Today, we are going to be focusing on the topic dealing with domestic violence, and specifically domestic violence with men. I specifically wanted to host this group because it became a concern within our space here at the halfway house, where a lot of our clients were survivors of domestic violence, but did not feel like they had a space in order to speak of the trauma that comes from such. So I appreciate you two just joining me in order to just talk. Just to mind you, everything is confidential, but prior to us disclosing our experiences, I just wanted to provide you with some information about the potential short-term or long-term effects that can come from what you experienced. So physically, there are short-term effects, as we know, in terms of cuts and bruises, but those short-term effects can lead to long-term effects such as gastrointestinal diseases, internal bleeding, broken bones, organ injuries, excuse me, in addition to the most fatal being death. Also, emotionally, you can experience feelings of shock, embarrassment, anger, sadness, anxiety, or nervousness in terms of being possibly perceived as the victim, or even then the dynamics between you and your partner can just bring up a lot of emotions for you. Physically, emotionally, but also psychologically, it is important. Sorry, everyone, my internet was messing up, but it's also important psychologically that there's also some influences when it comes to possibly developing anxiety or depression. Again, because this is a traumatic event, you guys are also susceptible to post-traumatic stress disorder, body dysmorphia. There's a heightenedness when it comes to possibly developing a substance use disorder or possibly another eating disorder that we possibly need to consider when it comes to disclosure, but overall future treatment. And lastly, when it comes to social, we need to not only look at our social groups internally, where being a survivor of domestic violence can lead to possibly being isolated from your support system, but also people who are in your support system being influenced by the experience that you had. So for example, if you had children, and the instance where you are a survivor of domestic violence or violence in general is a learned behavior. So in the instance where someone that you were taking care of noticed that either you were a survivor or noticed that there was a perpetrator that enacted the violence, the child can possibly demonstrate those same behaviors that can be, or really just create a risk into the internal support group. From a community standpoint, when it comes to public safety, again, a private matter such as domestic violence now becomes public, where again, it can provide a safety risk to possibly neighbors, schools, law enforcement, people who are supposed to protect you or want to protect you now are at risk when it comes to the disclosure of the perpetration, which can give a lot of emotions in terms of also influencing your ability to tell or not tell of you being a survivor of domestic violence. Lastly, we also need to look from a societal standpoint, the economic cost. Again, we need to look at the fact that we live in a society where it is about money, it is about working, and being in this halfway house where, again, both of you are prisoners, where it's already a disenfranchisement, or really there is a isolation when it comes to prisoners and those who are not prisoners. So along with being a part of the prison system and being a survivor of domestic violence, those are two factors that come together that can possibly limit you from certain opportunities when it comes to establishing some money, but in addition to establishing some stability in your life. So we need to also look at those costs. And along with healthcare, again, I referenced the physical impacts. That also plays a role into healthcare, because in the instance where you don't have money to take care of your future chronic health conditions, then those chronic health conditions worsen. So these are things to consider, and I look forward to working with you moving forward in terms of developing a safety plan once you leave the halfway house and how I can better assist you once we transition out. So thank you for your time.